Watching and waiting does not disadvantage patients, and if patients are asymptomatic with low volume disease, it is the right thing to do. There is no advantage in treating somebody early at diagnosis if they're well. That seems completely counterintuitive. You've got an aggressive kind of cancer, it's incurable, why wouldn't you treat it straight away? Well, the answer is that when you treat this disease, it inevitably relapses, and when it relapses, it's often a harder disease to manage. So putting that off as long as possible probably makes patients live longer. We have a study in the UK now where we have, it's essentially a watch and wait trial. It's actually called, it's labelled as a biobank. So any newly diagnosed patient with mantle cell in the UK goes on the biobank. We collect baseline material, and if they need treating, they get treated, and we're just following them for survival. Those that are clinically eligible for a watch and wait approach, so the patient's well, low volume disease, normal blood count, the clinician and the patient are happy to watch, they're being watched. And we have over 400 patients on that now, and we've just looked at patients who've been registered for over a year, almost 150, nearly 200 actually. And when we do that, we find that 40% are being watched to start with, which is miles higher than I thought it was going to be. And of that 40%, actually nearly 30% are still being watched at a year. So this indolent group is far more common than anybody ever thought, because you don't know if somebody's indolent unless you leave them alone. If you treat everybody, you'll never know that these people exist. The whole point of the biobank is to, in retrospect, try and find a biomarker. Because all the biomarkers that have been used, and SOX11 is a good example, have been from highly selected groups of patients who retrospectively were found to have a good outcome.